welcome to Trust TV. I'm Ruth from your communications team, and I'm joined today by three of our infection prevention and control experts in the Trust, Dr. Sarah Heatherwick and lead nurses Denise McDonough and Annette O'Hara. Ladies, you're very welcome.
Thank you.
I cannot imagine what it must be like to be an IPC leader through a pandemic. How have you managed during the past year?
Well, I think it's been a fast learning curve, and I'm sure that's been the case for all of the other frontline staff in the Trust. So can I say first off, well done to everybody. I think we're all, though, suffering because this is just going on and on and on without a break. And I know when I'm tired, the things that I forget about are really important things. So really, this is just to remind everybody, it's really important to keep trying to remember all the things we know work. It's really important to wash your hands, make space. That 2 meters is still very important, and cover your face. So PPE is really important and hasn't really changed. It's still as important as ever. But what we know happens when you're tired is you forget things and you do things wrong. So one of the things that I'm really passionate about is that we all remember it's perfectly good and okay to challenge our colleagues when we see them doing things that are not right. And so we've been very good about doing that through the pandemic. But just to remind you, whoever you are, it is good to be able to say to somebody, just to let you know, did you know you're wearing your mask inside out, for example? And that has happened to me. And what I say in that circumstance is, oh, thanks, really, that's great that you've told me that. And you can see how easily that happens. So just thank people for reminding that you've got your glasses on the top of your head, that you're wearing your mask the wrong way out, and say, thanks very much. I'm going to put it on the right way now, because we're all doing that now. Those little mistakes are creeping in, and we've got to work out how to stop that.
And Denise, is that something you've seen? Have you gone out with your mask inside out?
I can't say I have now. I don't think I've done that, but I have felt over the period of the last year extremely tired, exhausted. Sometimes my resilience has gone a bit, maybe a wee bit low, but I have to say that the team have been an absolute brilliant support. Annette's a fabulous support, as is Sarah. And we do work very well as a team and keep each other going, really. And I do believe that a day without a wee bit of laughter is a day wasted. And that kind of keeps me going. And that's the way I actually cope with things, really. So I would agree with everything that Sarah said. Yes, we need to remind ourselves, just a wee reminder of how we should be doing things correctly still. It's not that it's gone away, because it's still here. And to be honest, I want to make sure that I can get to the hairdressers, to be honest. And I think the only way to get that to happen is by everybody pulling together and doing the right thing. So, and I'm sure Annette agrees with me there too.
Yeah, absolutely. I suppose just to reinforce what Sarah and Denise have both said, you know, a big thank you to all the staff, because, you know, a lot of staff have gone beyond capacity, and they've come in on days off and worked additional hours. So, you know, we do appreciate that. I think we can't lose the focus on the compliance to PPE. When we're up on the wards and we're doing auditing, you know, some of the audits are being failed because they're not cleaning their hands before they put on, you know, the gloves and apron, and they're not, when they're removing their gloves and apron, you know, they're not doing it in that order of remove gloves, then remove apron, and, you know, the gelling or the washing of hands. So I think, you know, my message to staff would be, you know, the posters are there, you know, if you're in any doubt at all, follow the poster, or make sure you're checking with colleagues that you're doing it you know, that you're adhering to the donning and the doffing of the PPE. And I suppose primarily the hand hygiene, you know, using your 5 moments and your 7 steps. You know, that is my message to staff, because they are the basic fundamentals within infection control, and they're the things that are going to keep staff safe.
One of the things I wanted us to remember about, a lot of people have been asking me about eye protection. Do we really need eye protection? And my answer to that is yes. And I wear eye protection whenever I'm going to come into contact with anybody who might be a patient at all. And there's lots of different sorts of eye protection that you can wear. So if you're in an amber area, it's fine to wear either a visor or the special spectacles we have, or we in fact have over spectacles that, and I obviously wear eyeglasses normally. So the over spectacles for me are fantastic. They're much easier to wear than the visors. But what we know as we find out more about COVID is probably about 15 or 16% of infections are occurring through the eye route. And that's either because people who are infected cough into your own eyes, or that you are getting COVID on your hands and then you're touching the eyes. So anybody who's in a clinical area in our trust, that's, you know, the clinical areas are basically very crumped and close together, needs to be wearing eye protection all the time. And I know it makes looking at notes difficult, and if you're, you know, doing close work, it's quite difficult to see, but it is really important to eye protection on. But you can wear whichever one you like. You can wear a visor, and if you find the spectacles easier, get in touch with your PPE leads and they can get you some spectacles. And if you want over spectacles, we can provide those as well. Same route through the PPE leads.
Denise, I know from you work in a wide variety of community settings, and the issue of goggles is also something that really troubles you. Why is that?
Well, one of my favourite sayings is, "Dinny, wear your goggles on your head." And in English, that is, do not wear your goggles on your head. And I mean, I do see it plenty of times. People are wearing these goggles like they're sunglasses. And I mean, really, they're not sunglasses. I wish we did have a pair of sunglasses and we were going on our holidays, but that's not the case. The goggles are for wearing on our eyes and not our head.
What's the risk if somebody, because you do it, you don't even think, you know, you shove your glasses up, and whenever they're sitting on top of your hair, and if you pull them back over your eyes, what is the risk of that?
Well, what's all in this head at the minute? I don't know what's in my hair. I do know there's that funny spray which is all brown on it, so that's going to come off on the glasses. Your glasses will have bacteria on it from your head, so it's not a good idea. You're actually touching the glasses with your hands, so really they're for your eyes. Sarah, you might want to say a bit more on that in relation to the bacteria.
Yeah, so there, I mean, the theoretical risk, which is probably, if you do it a lot of times, it won't be a theoretical risk, it'll be an actual risk. So every time you put your glasses on your head that may well have COVID on it, you pop your glasses on your head, you wipe a bit of COVID on the inside of the glasses, and then you pop them on your eyes. Your hands are all over there, you're rubbing your eyes as you put them on. So they will, you know, increase the risk of you getting COVID if you put dirty glasses on. Having them on your head isn't the end of the world, so long as they get cleaned before you put them on. But, you know, none of us do that. When we leave them on our head, we don't clean them, we just put them straight down again. So if you find you've got your glasses on your head and someone has come along and said, I hope you don't mind telling you, but you're wearing your glasses on your head, rather than rushing to put them straight down, give them a clean on the inside and the outside with the wipes.
I think that's sound advice. So even, I suppose what you're saying is, it's when we're all exhausted like this, that these lapses can happen. And we've got, even if we put that at the forefront of our minds, that the very fact that we are so tired means we've got to remember, as Annette said, to get back to basics. and make that our priority. Annette, is there anything else, I suppose, that staff are raising with you at this point in time, or is it just that back to basics message?
Well, I think our message to staff, as I've said, is, to thank staff, for all their efforts to date. But, we're not out of this yet, Ruth. We still have many months ahead of us, with COVID and the new variant strains. And so, to keep staff safe and to keep our patients safe, we need to maintain our compliance with our hand hygiene, with our donning and doffing of PPE, and just supporting one another, Ruth. That, as Denise pointed out, we've all had days where we just need somebody to say well done and thank you. Or if we're getting something wrong, as Sarah said, to kind of gently remind each other, to do the right thing. So, it's work in progress, Ruth, and we continue day and daily to try and support staff. And if staff, are finding difficulties at ward level in terms of other people not being compliant, we will step in and try and support them.
So don't drop your guard.
Don't drop your guard.
So Denise, last warning then about these goggles. What was it we've got to tell everybody?
Denny, wear your goggles on your head. Don't wear your goggles on your head.
Thank you very much indeed, ladies. Thank you.
Thank you.
Thank you.